Next person to come is Dr. Radhika Kasilanka. Is she presenting? Okay. He's going to talk on efficiency of Barrett Universal 2 and SRKT formulae using immersion ultrasound versus optical biometry. Go ahead.
Good afternoon, everyone. Today my paper topic is a study of Barrett's 2 versus SRKT formula to calculate IOL power using immersion ultrasound versus optical biometry. Financial interest is nil. Introduction: cataract surgery has now evolved to the status of refractive procedure. So estimating the IOL power accurately is crucial for cataract surgery refractive outcome. One of the commonly used formula, the Sanders, Ritzelf and Kraft theoretical formula that was introduced in 1990, is formulated as a combination of both regression and theoretical approach and has been found to be accurate, particularly in eyes with axial length more than 27 mm. The Barrett's Universal 2 formula, an updated version of Barrett's Universal formula, was introduced in 2010 by Graham D. Barrett and has shown promising results so far. Aim is to compare the predictive accuracy of refractive outcomes after cataract surgery using SRKT and BUT formula by using immersion, ultrasound and optical biometry. Objective is to evaluate the influence of biometric method on the accuracy of each formula. My materials and methods: the study type is cross-sectional analytic study with 60 patients, 30 patients in each group, and duration of study is 9 months, done in a tertiary hospital. Informed consent is taken, institutional ethical clearance was taken. Inclusion criteria is patient above the age of 50 years and existence of age-related immature cataract and no history of previous surgery of anterior or posterior segment of eye. Exclusion criteria is with any retinal or corneal pathology, traumatic cataract, congenital cataract, complicated cataract, glaucoma, squint and corneal degenerations and corneal high astigmatism. Methodology is patient demographic details have been recorded and patients are divided into two groups, Group S and Group B. In Group S, again are divided into two groups, 15 in each group, that is immersion group and biometric group. And in same division is done in Group B. All patients underwent a comprehensive ophthalmic examination, including the best corrected visual acuity, tonometry, slit lamp examination, fundoscopy. Biometry was done using immersion method and optical biometer, and ARK machine was used. All patients underwent standard phacoemulsification procedure with 2-point mm incision, and implantation of foldable IOL is done and performed by a single surgeon. Only uneventful surgeries were included, and best corrected visual acuity was measured at post-operatively 6 weeks. Refractive error predicted was obtained was tabulated. Comparisons of outcomes in both groups was performed. Statistical analysis: the collected data was entered and analyzed using Microsoft Excel 2019. Independent sample t-test was used to compare the means between two groups, and paired t-test was used to compare the means within the group, and p-value less than 0.05 will be considered to be significant. In results, there is no significant difference in predicted error in both the groups, and there is a significant difference in the obtained error in both the groups and within the groups. In a discussion, in Dimiana et al., with 34 patients, the study concluded that Barrett's Universal 2 formula outperforms both the SRKT and Haig's formula for highly myopic eyes. Whereas in Kutumalol et al., with 244 patients, Barrett's Universal 2 formula performed the most accurate formula in the prediction of post-operative refraction over a wide rise of axial lengths. My limitations of study are, as we included only uncomplicated cataract surgeries, no prediction can be made for eyes with unusual K or skewed anterior to posterior segment ratio. And our study was performed on cases in which only foldable IOLs were used, and different lens models should be investigated in the future studies. And the conclusion is the Barrett Universal 2 formula provides better predictability of IOL power calculation than SRKT formula, and this is also more accurate when it is calculated using optical biometry. Thank you. These are my references.
Thank you.
Well, you have mentioned the conclusion, yeah, but your results don't match your conclusion. Your results says it's equal, and then you are saying that Barrett is superior to SRKT. How does this conclusion match your study results? You agree that no? You only mentioned that it's equal. There was no.
There is significant difference in obtained error, sir, but there is no significant difference in the predicted error.
Okay. Okay.
In predicted error, there is no significant difference, but in obtained error, there is a significant difference.
So why is Barrett called a universal formula? Any idea?
This is a new generation formula and ought automated?
No, it is called universal because it works across different axial lengths. So in your sample, if it should have the whole range of axial lengths for you to have a meaningful comparison between the two. SRKT works well in the normal axial length eyes. So definitely that is what is shown. The error of the axial length calculation is out because you're doing immersion calculation. The only error that can happen is your formulation error. So formulation error is only possible if you have the whole range of errors. So that is the reason why you got that result all right.
This is tested by the single person, or readings were taken by the single person, or
Single person.
single person?
Single
Okay.
optometrist.